What if the very treatment that saves lives is misunderstood, feared, and surrounded by so many myths that it prevents people from getting the care they need? Many believe that radiation therapy makes you radioactive, causes severe burns, or leads to widespread hair loss and nausea. None of that is true. I'm Dr. Chaplin, and as an immunologist who designs drugs, I've seen how these misconceptions can create unnecessary anxiety and deter patients from effective treatment. Today, I'm here to clarify the facts and demystify radiation therapy and debunk 5 common myths. Stick around because understanding the truth about radiation could be crucial to you or a loved one. Hello everyone, and welcome to Elevating Cancer Treatment. A quick reminder, information in this video is for education and should not be viewed as medical advice. Always consult with your personal healthcare provider for guidance on your specific situation. That's critically important. Every cancer is different. No advice is applicable to everyone. Here on this channel, we explore the intricate world of cancer, dissecting the science and debunking common myths to help you navigate your health journey with clarity and confidence. What distinguishes my approach is a dual commitment. Beyond educating about cancer, I'm involved in crafting the innovative drugs and treatments that are defining the future of oncology. This direct, hands-on experience offers me a unique grasp of these therapies' molecular mechanisms and their interaction within the human body. And that's an insight I'm excited to share with you. If that sounds like something you're interested in, make sure to like this video, subscribe to the channel, hit that notification bell, and that way you'll never miss an update. Before we dive into today's myths, 2 quick things. First, as a thank you for being here, I've created a free resource, 10 Things to Know About Chemotherapy, which you can download from our website using the link in the description. And second, by signing up for that guide, you'll also get exclusive updates on the innovative new cancer treatment that I'm working on. I'm confident this represents a significant leap forward in immune oncology, and I'm committed to bringing you direct updates on its advancements. Take a moment, download your free guide, and join us in shaping the future of cancer treatment. So, today we're shining a light, pun intended, on radiation therapy. For many, the idea of radiation can be totally daunting. It's surrounded by misconceptions and fears. That's why we're here to demystify this powerful treatment by debunking 5 super common myths. Our goal is to provide you with clear, accurate information so you can better understand what radiation therapy truly entails. Let's get started. Myth number 1, patients become radioactive. Total myth. This is a significant concern for lots of patients and their loved ones, but it's outdated and honestly was never really accurate. It's got to be thoroughly debunked. With external beam radiation therapy, which is by far the most common type, you cannot become radioactive. Think of it this way. When you walk outside on a sunny day, you're exposed to radiation from the sun. But when you walk back inside into a dark room, you don't glow or emit radiation, do you? It's the same principle with external beam radiation. It's like a flashlight. A machine delivers the radiation to your body, and once that machine is turned off, there's no more radiation in your body. You're not radioactive. You were radiated. You are not radioactive, and you pose no risk to anyone around you. The only time a patient might become temporarily radioactive is if they receive an injection of a radioisotope-labeled drug. These are specialized, highly targeted treatments where a radioactive substance is attached to a drug designed to target cancer cells. Even in these cases, the radioactivity is typically very short-lived, and because of the specific targeting to cancerous cells, the dose is small enough that there's no exposure risk to people in your environment. The only exception to this is radioactive iodine, or iodine-131, therapy for thyroid cancer. This specific treatment does require an overnight hospital stay because patients do temporarily become radioactive and need to be isolated for that very short period of time to ensure safety. It's 1 night. It's 1 night. That's the worst. Myth number 2. One of the most common fears associated with radiation therapy is the idea of severe burns and widespread debilitating side effects. With the advancements in modern radiation oncology, this hasn't been true for decades, and it's only an outdated, scary myth. The fact is, contemporary and precise techniques such as intensity modulated radiation therapy, or IMRT, and stereotactic radiotherapy, like gamma knives, are designed to minimize damage to healthy tissue surrounding the tumor. These technologies allow for highly targeted delivery of radiation, sparing healthy cells as much as possible. When it comes to skin changes, what patients typically experience is localized, resembling a mild to moderate sunburn. It's important to understand that this is a skin reaction to the radiation, not a heat-caused burn in the traditional sense. Many newer approaches utilize multiple beams that individually deliver a very low dose, only converging and delivering the full effective dose where those beams overlap at the tumor site. This precision significantly reduces the impact on surrounding healthy skin and tissues, making severe burns an incredible rarity. Myth number 3. Another common concern is that the actual process of receiving radiation therapy is painful. That is a complete and total myth. The truth is, the treatment itself is completely painless. Beam treatment is like getting an X-ray or a CT scan. You lie on a treatment table, the machine moves around you, delivers the radiation. You won't feel anything during your treatment session. While the process itself is painless, it's true that side effects do develop over time, depending on the area being treated. Fatigue and skin reactions typically take about 10 to 14 days to develop, but they're not immediate sensations during the treatment itself. Myth number 4. Many people associate cancer treatment with widespread hair loss, nausea, and vomiting. That's often due to the outdated portrayals in radiotherapy media, old movies. However, with radiation therapy, these side effects are typically very localized and depend entirely on the area being treated. Hair loss, for instance, is localized to the specific region receiving the radiation. So only patients receiving radiation therapy to the head would experience areas of scalp hair loss. If you're receiving radiation to your breast, you might experience some localized armpit hair loss, but your scalp hair will remain completely unaffected. Similarly, nausea and vomiting are not common side effects unless the radiation is directly aimed at the stomach or the small intestine area. And even then, it's often managed well by medications. If your treatment area is, say, your knee or your lung, it's highly unlikely that you'll experience these GI side effects. This distinction is crucial for understanding what to expect during radiation treatment. Myth number 5. Radiation therapy will make me develop another cancer. This is a very serious concern for patients, and it's important to address it with nuance. While it is true that there is a very small increased risk of developing a secondary cancer later in life as a result of radiation therapy, this risk is very rare. While it can be hard to untangle the multiple factors for secondary cancers, the overall risk across all types and treatments is 17 to 19%, and the radiation therapy portion of this is estimated to be below 5%. One thing to think about is that the risk for secondary cancers has doubled over the last 30 years, while at the same time radiotherapy doses have decreased 4-fold, so there are other factors driving that increase. Part of that is likely supplement use, but we'll cover that in a different episode. More importantly, this rare and delayed risk is far outweighed by the significant and immediate benefit of treating the primary cancer. In many cases, especially when surgery is not a viable option, for example, with tumors in the brain or very close to critical organs like the heart, radiation therapy is the most effective way to treat the cancer. The decision to undergo radiation therapy is always a careful balance of risks and benefits, and your medical team will discuss this thoroughly with you, ensuring that the chosen treatment path offers the best possible outcome for your specific situation. So, there you have it. We've covered a lot of ground today, fairly surface I know, but a lot of ground, and we've debunked 5 common myths about radiation therapy. Some were probably what you expected, and hopefully some surprised you. Remember, modern radiation techniques are highly precise. The treatment itself is painless, and you do not become radioactive. You cannot become radioactive. Side effects like hair loss, nausea, and vomiting are typically localized and depend on the specific treatment area. They're not widespread like you see in the movies. And while there's a minimal risk of secondary cancers, the benefits of treating the primary cancer far outweigh this rare and highly delayed possibility. Beyond these videos, if you need a more personalized guidance or deeper dive into specific treatments to have your treatment be as effective as possible, I offer one-on-one sessions. I'm also currently in the process of developing an exclusive video series that breaks down each drug and treatment in detail. You can find information on both these resources on our website, linked below. So, after watching this video, what's one step you plan to take to better understand your treatment options? Or what will you share with a loved one about radiation therapy? Let us know in the comments. Be sure to like, share, and subscribe for more science-based cancer insights. Thank you. I'll see you in the next video.